Hi, Lorraine. My name's Laurel. Are you participating as as a commenter? I can't hear you. I'm guessing you're muted. You're muted, Lorraine.
Am I okay now?
Yep, now I can hear you.
Oh, okay.
Are you participating in the meeting just to watch it or make comments?
I want to make some comments, yes.
Okay, so my name's Laurel. I'm one of the board members and we're just getting going. So we'll have some guidelines for comments.
Okay,
We may present a few things. We may flip the order. So just stay tuned. So get yourself a cup
okay.
of tea and stay on mute and you can just keep listening.
I have a water right now.
All right. Thanks for joining. So
Thank you.
we'll have you stay on mute until we get going, okay? Until it's your turn to speak. That's terrific. Thank you. That work or home, Candace? It looks very official.
Done? No work.
Candace, it appears that we have several people participating in the meeting. So I've already explained our order to the first person, Lorraine. We'll work on muting when appropriate and figure it out as we go.
Yeah, I wonder, I was actually thinking maybe just to handle quickly the approval of the minutes and maybe the camp fees, as long as everybody's on for that, and then we'll just devote the majority of our time to the rest.
Your meeting.
I think we're ready to go, right? looks like we have Elaine, we have Anthony, we have Cindy. Okay, so it is 6 o'clock. Good evening, everybody. October 19th, 2022. This is the Wakefield Board of Health. Let's call this meeting to order. Present myself, Candace Linehan, Laurel Garville, Elaine Silva, Erin Hull, Anthony Choi, Cindy's here. We have some public participation this evening, which I'm looking forward to. Why don't we start with the minutes? Any feelings on the minutes? I read them, other than the point you made, Laurel, earlier. The late queue.
Right, that we would just put that next time, that's
Yep.
fine.
But other than that, any changes, any thoughts?
No, I have no comments. Elaine,
No comments at all.
I'll make a motion to accept the meetings for the September meeting as written.
And I'll make second that motion to accept the minutes.
All in favor?
Corville, I.
Silver, aye.
Linehan, aye. So moved. Excellent. Anthony, do you think we should wait for Melissa or for Sandy? I don't believe I see them to speak about the camp fees, or
No, I'm not sure. I think Melissa was going to join us, but I'm more than happy to, because we discussed this already, and I think you guys received the memo. I'm more than happy to kind of go over it. And if Melissa joins us later, I'll let her know that we kind of went over it. But I'm not sure if she's able to make it right now.
okay. Yeah, I think it seems pretty straightforward. I read that memo too, and it made sense. It was just pretty much the same thing we discussed at our last meeting with them anyway.
Yeah. So just kind of an overview was just we went over. Sorry, give me 1 second. Yeah, we went over the amount of hours that are spent. Part of it, being the great inspections team we have to go and check on these camps, as well as our public health nurses that have to go basically week by week to follow up on this. So I think our original $10 fee was pretty nominal. So I think it's important for us to kind of be at least in line with the rest of the communities in our area. I think 200, just based on the research from the other communities in the surrounding area, camp fees are roughly that. Yep, I'm glad the board is considering the change.
Okay. Is anybody prepared to make a motion to?
I just want to add that I did do a follow-up, yesterday when I looked at this and sent the link to the Alliance for Camp Health, or the Camp Health Alliance. I can never remember which way they say it. I would recommend that the board consider becoming a member so that our nurses can have access to those resources. The resources are, and I can certainly, I think I sent the email to Anthony and Melissa.
Yes, you did. Yeah, both of us got it. Yep.
Yeah, so it's, as I told you before, they changed their name from the American Camp, or the Association of Camp Nurses, to the Camp Health Alliance, or vice versa, as part of the American Camp Association. And I have been really impressed with the quality of their work. And what I'm hopeful is that there would be resources in there that the department would know of, but also that could be pushed to the camp so they in fact could set up their own systems. But just, we have the resources out there. There's no reason for there to be competing work for our health department nurses if we can at least set in, kind of evidence-based practice standards that camps should have. Not all camps are certified with the American Camp Association, but I think sometimes what we're hearing is people aren't even aware that they're there. So I think it's a first step. I recall it's fairly nominal. Either it can be just the nurse, our nurses having a membership, or you can do it as an institution. And I would endorse that we utilize that resource. In the meanwhile, I'll make a motion to accept the increased fee for recreational camp permit fee to be increased to $200 a year.
Elaine, I believe you're muted.
Usual for me, huh? I'll second that motion for the camp fees to be raised. Thank you.
All in favor?
Corville, I.
Silver, aye.
Linehan, aye. Done. Okay. So moved. And before we get into 95 Audubon and the residents, is anybody here? interested in public participation about something other than that property this evening? Speak now or forever hold your peace. All right, so my understanding is that everybody who's joining us tonight is here to participate publicly in regards to 95 Audubon. Great, okay. Anthony, do you want to take the lead here?
Madam Chair, might I just suggest that we give guidelines to the public and that we're going to actually go for the presentation from Health Department, and I'm just making a suggestion. We'll listen to the presentation and the concerns, then listen to public participation, then listen to Audubon. Does that, Erin, does that look, yeah, does that make sense to people? So I would just, I know that we have had participants before from the property and we always appreciate the feedback. So the guideline, we'll walk you through the guidelines, but as a board, we listen. We won't be able to do a discourse where it's a back and forth discussion. Our job is just to listen to the public participation, and then the board may or may not have a decision or an action plan tonight, but we may be taking it under consideration. So I just wanted to give you some anticipatory guidance. We'll get the best use of time and information, and I'm hoping that some questions or concerns may be answered in the initial presentation, and we generally try to keep comments between 1 and 2 minutes. Thank you.
Right, and we can review that once Anthony finishes his presentation also for anybody that's still in the process of joining. And everybody that wants to have a moment to speak, we'll make a list and you'll have your opportunity.
Okay, that sounds good. So thank you guys again. I'm just going to start by giving kind of a general overview. Erin will also have more details, kind of what we've been working with. But essentially, 95 Audubon Road, Colonial Point, we've been working with for a long time now. There's just been a litany of issues that we've been made aware of by the tenants on a pretty regular basis. And so this dates back to, much further back, but really it has picked up since the beginning of this year. We had the unfortunate incident of the fire earlier this year. But other than that, just, constant issues of sewage. We've had two sewage line breaks in the last, 10 months? In the last 10 months, we've had 2 major sewage breaks, both of which have threatened conservation land near that property. This is unacceptable. I mean, this is, there's a backup drinking water source right next to it. This issue was obviously brought up in the first break, but the issue was not fixed. It was just patched. And so thus we had this sewage break over a month ago, second time, which has also caused many issues. We have brought this into attention of the DEP as well as our conservation board here in Wakefield. This is a serious issue. This is a threat to the residents there as well as the surrounding area and the environment. So we wanted to bring that up as well. Due to all of the issues, I mean, we have constant complaints of trash chutes being blocked, trash rooms overflowing. Trash pickup is just not something that is consistently done there. And whether that's related to the vendor or not, this is a responsibility of the ownership group to make sure that minimum sanitation requirements are met. So, with the constant issues, unfortunately, the residents have turned to us as kind of the, kind of like their maintenance line. And, as much as we like to help the residents of Wakefield, we have limitations as well. And we want to make sure that the residents have access to maintenance on the property. And so, you can call that 800 number that is provided by Care Better Properties to the residents, and it goes to a calling service. And you won't hear back for a long time. Sometimes you won't hear back at all. We have not been able to, work with competent property management at this site for, at least, Erin, correct me if I'm wrong, about 2 months now. Is that right? Yeah, just about 2 months. So,
Yeah, including the air conditioning issues that, started in the summer.
Yeah, including the air conditioning issues, and air conditioning, as it may fall outside of the housing code of Massachusetts, I mean, it is absolutely ridiculous that the air conditioning is not available pretty much the entire summer, but we experience multiple heat waves. I mean, we have folks living there that are at high risk. We have some senior folks living there. You know, these are dangerous conditions that they are causing. You know, not even to miss, you know, with all the trash chutes and the trash issues. I mean, this is also exacerbating our rodent issue that we see in Wakefield and the region, you know. So this is important for us to go over a lot of these conditions that are affecting our residents here in Wakefield. Some of our most vulnerable residents live in this property. And I think it's important for us to shed light on this and to make sure that we have some accountability on that end, right? We've been in contact with HUD and DEP about just, you know, the variety of issues that Care Better Properties is allowed to go on at this property for a long time. And you know, we want to present this to the Board of Health tonight to, you know, help in that step and bring some accountability to this. Erin, do you want to kind of go over? I may have missed a few things, but I think it'd be good if you go over it.
Yeah, sure. I can go over specifically the issue with the manhole breaking and sewage leaking in September that we dealt with. So on, let's see, on September 21st, I believe I was contacted. We were contacted about the strong smell of sewage in the area and, you know, a complaint that there was sewage on the roadway. Our inspector, Dan Thompson, went out there and took pictures and said, you know, it smelled like sewage, it looked like sewage, and there was, you know, what seemed to be a broken manhole cover. It took me writing an order and phone call after phone call for 48 hours before Carabetta got a pump truck out there to pump any sewage and start the process of any emergency repairs. And even during that, they didn't really keep us in the loop as far as when the repairs would happen. Yeah, and you know, they had to have a pump truck there all weekend. I went out Monday. I think the initial complaint was on a Wednesday. I went out the next Monday. There was no excavating done. The repair hadn't been done, and there's still sewage in the road and there's no pump truck there. So I had to order them to have the pump truck go back. So just, you know, tons of time spent watching this property because of the continual issues that the residents are dealing with there. And as far as the trash chutes, the same thing. It's, you know, they don't have around the clock maintenance. So the residents are not responded to, and they call us. And when we call Carabetta and say, you know, oh, you need to clean out the trash chutes, we don't get a call back either. So we have to go out there and manually clear the trash chutes for them. Like, it's like, we don't know what else to do. And we are just like at our wits' end with working with Carabetta. And they usually, like, they address the problems, but like after pulling teeth, you know, like after, you know, days of correction orders and fining, and it's dehumanizing to the way, like, to treat residents this way.
And also not to mention, I mean, the lack of maintenance around the clock, like you mentioned with the trash and everything. I mean, there's also a pool that, you know, Colonial Point has been trying to open for a while. You know, per the pool code, I mean, if you only have maintenance for, you know, 2 hours or several hours here and there, especially on the weekends, you can't have a pool open. I mean, this is, you know, this is just negligent at this point. So I think it may seem like a small point, but I mean, this is also part of what we're looking at. So I think Erin summed it up really well. I think, you know, part of it's timeliness, right? Some of these things can't be ignored for this period of time. And the lack of communication, I think she nailed it on the head in terms of we don't hear back when we reach out about the status of projects, about when they're being fixed, and the residents don't get the courtesy of that either, right? So then the residents reach back out to us looking for an update, and we don't have that. So I think it's, you know, it's a combination of things that we need better service, and we need, you know, more accountability on their end to respond to their residents.
Okay, thank you, Anthony and Aaron. So again, why don't we give the public an opportunity to share their thoughts? And let's try to keep the comment time between 1 and 2 minutes. Anybody that would like to participate, if you are able to use the raise your hand functionality, that would be helpful. And I can make a list of everybody who's got their hand up. And Cindy, would you be able to help us with some timing?
Yeah, sure, I'll time it.
Thank you. Okay. Again, this is going to be an opportunity to share your thoughts. This isn't a discourse between the board. When you reach around a minute, we'll give you a warning and we'll ask that you kind of finish your thought. And we'll move on to the next person. So anybody else? I see Lorraine has her hand up, so you'll be our first participant. Anybody else here interested in participating? If you're not familiar with the raise your hand functionality, you could just unmute and just let me know. Okay, Lorraine, it looks like it's you. Why don't you go ahead and
I think she's muted.
Lorraine, would you unmute, please?
Am I unmuted now?
Yes, ma'am, you are.
Okay, mine goes back to 2015. I had a flood, my toilet tank broke. I had 5,000 gallons of water in my apartment. That's what the fireman told me. I came to the Board of Health. Board of Health tried to help me. They said that I had to have new vinyl, not new vinyl and my carpets. They came, Carabetta did come in here and they checked my carpets and they said that they weren't wet, even though I was walking in wet carpets. And now I just have these little bites on my arms. And they said nothing. Now I even took them to court and they didn't even show up in court. And I have the summons in front of me. And I can even give you a docket number if you want the docket number. And
Sure.
what is?
1 minute.
Thank you.
Okay, next. All right, where the heck is the docket number? Is the defendant property number, docket number 1650 CR 000262. And they also have a letter from them stating that they came in and looked at my carpets. And then they put new carpets. They never came in and did that.
Okay.
That's my big complaint. I have all the paperwork here.
Okay.
I mean, and I did go to Jennifer Keogh at the time. I don't know if she's still with you guys.
No, I don't believe so. No. Okay. All right.
That's the person. That was my big complaint.
Okay. Thank you. Thank you very much. Is anybody else interested in participating publicly? If not, we will go ahead and close public participation and let Carabetta have some time to speak. No?
Well, the-
Okay. Oh,
The
Yeah.
other thing is I was just diagnosed with Parkinson's disease, and I don't know if that has anything to do with it.
okay. Thank you. Erin, did you have something?
Oh, I was just gonna say, I've spoken to a lot of the residents there. A lot of them are afraid to speak out because they fear retaliation. And if they do get served an eviction notice, there's not a whole lot, like the health department really can't help them. They would have to bring Carabetta to court. And, you know, a lot of people can't afford legal representation and, you know, so, you know, illegal evictions can happen regardless.
Thank you. Okay. Last opportunity to participate if anybody would like to this evening. Okay, so we'll close public participation and the representative from Carabetta, perhaps you could identify yourself?
Yes, my name is Attorney Robert Russo, R-U-S-S-O.
Welcome.
Thank you very much for having me. Just one thing before I make a few statements. If Lorraine is still on and she can hear me, I would suggest that she contact the office. The docket number that she gave is a criminal docket number. It's not a civil docket number. I don't know who she sued. That was back in 2015. If she has an issue that the carpet needs to be replaced, there's a phone number there. If she can't reach anyone, she can certainly call me. I even gave Aaron my contact information. I've been representing Carabetta for the past 10 years now, most recently in this project, among others. So she can call me at any time. I'll give you my phone number if Lorraine wants it. She contact me and I'll make sure that somebody gets down there and takes a look and see in fact if she needs new carpeting. Other than that, I'm not going to be anything specific relative to any tenants. It's confidentiality issues, but she has spoken up. She has an issue, so she can either call the office or call me, whatever that she wants to do.
Attorney Russo, could you put your contact information in the chat?
Certainly, we'll take care of that. I'll have my associate do it while I'm talking.
Thank you.
I know there's several things that have come about. One of which is the trash chutes. First of all, we can't control what the tenants do. I've seen the pictures. If there's an issue, what I would like the tenants to do, and unfortunately no one's here, contact us first. We have a maintenance band that goes around every day, all day long. We certainly can't see all the trash chutes 24 hours a day, 7 days a week. That's impossible. As far as picking up the trash, we had a problem with our trash company. They had a scheduling issue. They had an issue with having people come and work for them. We threatened with them to find someone else. Now they're back on board. So the trash is being picked up. The whole country is going through kinds of problems with supply issues. Once in fact, and I believe Ms. Hull knows that we corrected the issue relative to the sewerage. I think it was done within 2 weeks, if I recall correctly. It may not
There's
be.
no chat function.
I'm sorry, there is no chat function on the Zoom. Anyway, so it's now done.
That's correct.
If the tenants have an issue, there's a phone number to call. There's a 800 number to call. There's an email address to call. Aaron's been dealing with Fred Levitan, the senior property manager. He's extremely responsive to everything that goes on in this building and this complex. And if not, I gave Aaron my contact info. I think she has it. In the future, if there's a problem, contact me. When it gets to me, it gets done. Me and Fred will get done. Aldo Panasso was a senior manager. He's the director of operations. I don't know if he's on now. He's supposed to be. He's there at the building every day, and we can make sure that the work is done. Here he is now. So it'll get done. We are here to service these people, but this has been a terrible incident for our country for the past 2 years with this pandemic. A lot of people are not working. A lot of people don't want to work. We've had trouble getting managers. Our property manager quit. She was with us for 3.5 years. It took us 4 weeks to find someone competent and capable, and we now have her. And her name is Donna Gomez. The phone number is the phone number that's in the office on the wall. It's 781-245-0414. Her email address happens to be, if I can find it, I'll get it eventually.
I've asked Fred for that several times and I still do not have Donna's email.
I don't know why I don't have it here, but I do have it here. Oh, here it is. It's Colonial Point LSG, all one word, @gmail.com. Colonial Point LSG, L as in Larry, S and the Sam, G as in George, @gmail.com. And I believe, Aaron, you have Fred Levitan's contact info and you have mine too. So there's another, if there's a problem in the future, you can call up, send emails, all three of us. I respond to them. That's what they pay me for. Want to make sure that we are satisfying, helping, and doing what we can do for all our tenants in this building. But it's too bad more people aren't on tonight, because we can just say to them, if there's an issue, contact us, send us an email. The problem that we have is that by the time we get it, it comes from you. It doesn't come from the tenants. For example, that trash chute, we didn't know about it. No one contacted us. Tenant didn't tell us the trash chute was clogged. And by the way, I'd like to find out which tenant clogged that trash chute, because we'd like to send them some kind of a letter saying that that shouldn't happen. People should be responsive to where they live too. It should be a working relationship between both parties, not just the landlord, but the tenants too. We want to make sure that the tenants are satisfied and serviced. But as I said before, this pandemic has caused a lot of problems with supply issues for even air conditioning, supply issue with trash. I'm sure that you people in the cities have found that to be true too. We still have supply issues out there. People waiting months for refrigerators, stoves, anything that had to be needed. We know our responsibility. Carabetta is not going away. We're not shirking from our responsibility. I'm here tonight as a representative for them. And I'm telling you that we will abide by what you want. But I just ask if a tenant does call you, send them, have them contact us. Give them my email, Fred's email, Donna's email, phone numbers, and we'll get done. That's all I can tell you.
Robert, thank you for telling us that information. And I'm glad to hear that there's going to be, there's going to be a change moving forward. I think what's important is, we can dig up history all we want, but these trash issues have lasted longer than you've said. And I don't have your call logs. I don't see if the residents are calling you first, but the residents are reaching out to us and saying they call that 800 number and they don't get anything, for days on end, and then they reach out to us. So as you can see, we're in that position too, right? I mean, we don't follow your guys' call log.
I understand that. The first number that they should be calling is the office manager's phone number. Unfortunately, they don't.
Correctly.
I think some of the issues has to be, and I've been doing this for over 40 years, landlord and tenant law, dealing mainly in the city of Boston. And the problem that I find, and I think it's here too, is the tenants like to reach out to the city first because they feel you guys are going to react more quickly than we do. And that's part of the problem we have. If they reached out to us first, that wouldn't be the problem. That's just an opinion.
So one of the issues that I've dealt with is, that's one of the first, if I get an email from a tenant, I'm like, oh, did you contact property management? Because, I'm not going to send an inspector out there if you haven't called maintenance. And they say yes. I can't prove that, but they do say yes. Yeah, and it's hard to expect the tenants to have pride in where they live when the property is not being maintained adequately.
And I think,
I think
part of it is, and Aaron, I think you're right, but I think part of it also is you're here telling us that, they should be calling you guys first. Unfortunately, I think that responsibility lies with you guys as management, because I think that needs to be communicated with your residents, right? If you have a number that you can be reached at, as if you're going to be, you and Fred and this, and the property manager and this 800 number are going to be the ones accountable, this should be made available from your management to them. It shouldn't be us telling them, here's the phone numbers to call. Do you see what I'm saying?
The numbers are posted and the property is required by the state sanitary code. The numbers are on their leases when they move in. They know who to call. They know where to go. They know what to do, but unfortunately they don't do it.
Is your number posted there as well?
It's posted.
It is. Well, his number's not posted.
My number's not posted.
So I know, and I'm listening to what you're saying, and I get it. There is information already out there. I'm not disputing that, but I think it's not a one-off, right? I mean, as property management, if this continues to be an issue, you can keep reaching out to them. That's part of being that, right?
Other than putting out the numbers and the contact information in the office and the leases, only thing that we can do is when tenants call, give it to them again. I mean, we can even post something if you want to have my client post another notice in the office again.
We will,
numbers and take care of it. We'll take care of that tomorrow.
We absolutely will give them those on numbers, but I think it's important, email, whatever communication, if you use paper, you use email, phone, however you communicate with your residents, that also has to go out as well from your end, right?
I also think that the cities and towns should realize that the landlords did not cause the problem. Trash chutes, we didn't come people up and clog the trash chutes for it. It's the tenants in there sometimes. It's not all of them, but there's some tenants that don't care about how they treat where they live and what they do. And I know that from experience. So when you say it's always, it clearly it is. I know what the code says, and we are going to do that all the time. That will happen. But it's the tenants, for example, that the picture that Aaron showed us, okay? Clog chute. The tenant should realize, by the way, it's too big to fit in the chute. And if it couldn't fit, walk down to the office, because it was done in daytime, I'm sure. By the way, I couldn't get it out. Have someone, and we would have done that, but they didn't do that. What they did was they clogged it up. The next person came, couldn't use it. First thing they do is call you. So
And
Sure.
I,
Well, and then
I
the-
fully
realize
understand.
that the tenants are the one responsible for the actions here. They caused the problem, not, we're trying to correct, trying to give them what we are supposed to give them. That's all.
Sure, yeah, and I agree with that. I think tenants should, in principle, I think tenants should take care of where they live.
I agree.
100%. I never would deny that. I also think, unfortunately, when you assume the responsibility as a management company and a landlord in a city or town, you're assuming responsibility for your tenants as well. I think that needs to be, that needs to be said, because I think, blaming the tenants, sure, there's some personal responsibility on that part too. But when it comes to enforcement, you are signing and you are taking the responsibility of your tenants within the town. Is that correct?
That is correct.
And like when Donna first started, her phone didn't work for about 10 days because she didn't know how to check the voicemail. So I tried calling her, residents were trying to call her, and there was no one to call at the front desk. And the voicemail box was full and she didn't know how to check it or delete them because she was put in an office and not trained and just,
Well,
sent
in
to.
all fairness, John, and I'm sure you've had this happen too, with Verizon and Comcast and all these other major entities, they are not helping landlines. They want everyone to use cell phones, and that's going to happen sooner or later. You won't find any landlines. They're not installing landlines in homes anymore. It's only in offices and buildings. So yeah, but that has been corrected now. I'm telling you, we will respond. If there's an issue, you have all my contact info and Fred's, and you just do that and you will hear from us.
Rocco, I see you have your hand up. Can you identify yourself, please?
Can you hear me?
Yes, we can.
Yes, my name is Robert Demaro. I'm a tenant actually at Colonial Point. I moved recently from 511 to 302.
Okay,
And I
hold on
want
one
to.
second, Rocco, just 1 second, thanks.
Yep.
I'm Candace Linehan, the chair of the board. I'm gonna give you the opportunity to talk, but we did already close public participation. So if you could just try to keep your comments to about a minute.
Sure.
Thanks.
No, absolutely. I just logged in and I see one of their lawyers putting the blame on the tenants, and I just wanted to put my 2 cents in, saying that I had a major issue with a major flood that happened in my old apartment 511. It took them over a month, even after the Board of Health came out and gave them an order to fix within 24 hours. Took them over a month to come out. I couldn't contact anybody because there was no one to contact. Every time I called the phone number, I would get someone to answer the phone and then sends me to a voicemail to some person who I've never spoken to, which is always voicemails. As far as the trash chutes, the trash wasn't picked up for over a week and a half. And that was because of non-payment according to the trash companies. So, I mean, it's not the residents' fault. What are we supposed to do with our trash? It's you're putting the blame off on other people when clearly the management has failed.
Thank you, Rocco. I appreciate that.
If I can respond just briefly, I'm not going to respond quickly with Rocco, but very briefly. I did not blame all the tenants. Clearly, no. 99% of them are great people. Every apartment building in our country has 1% that's a problem. And that 1% caused the problem for all the rest of them. So I did not blame all the tenants.
Laurel, why don't you go ahead?
Good evening. My name is Laurel Gorville. I've been on the board since 2009. Just a little bit of background. We have other properties in Wakefield, and we don't have a file on any other property in comparison to this property. I would also say that we need to move forward and we need to tighten up this communication. This complaint that people are not being heard is chronic. When we have had representatives from Carabetta come, quite frankly, it has been a circular conversation and it has sounded disingenuous. I have been there firsthand, as has Elaine Silva. We've both been on the board since 2009. Those are soft observations, but we do have a record. And we have a record of very lax follow-up and always disgruntled. I'm not going to use appropriately unsatisfied tenants. I'm wondering, as I'm listening to this, what the solution might be going forward. So I may check with Wakefield Council, but things like, can there be a responsible tenant board that responds to these issues? And will they be listened to? Can there be a quality assurance and a checklist and a test that when someone is brought into the new job, that there is a checklist of competencies and the phone is checked? If the phone number is changing, is it properly looked at? This can all be done with quality assurance measurements. We do this in hospitals all the time. Housing is a little bit different, but these complaints have been endless for decades. So we are trying to work with other municipalities who have similar complaints when we compare notes. We are interested in solving the problem. We don't want to hear the excuses. This predates COVID and lack of and supply chain shortages. This is an attitude of callousness from Carabetta that has been going on for years, and we would like for it to improve. So I am wondering if you can bring back to Carabetta some remediation concepts that will actually work. And part of it would be quality assurance, where on a monthly basis, you can prove to us that someone can answer the phone and that there is a response time. Aaron, I'm sure that you are taking notes on, I made this call, didn't get a response time till whenever. I would recommend to people who are calling Carabetta to please document anything that you're doing and keep a record of that, so that we can look at it and say, are we improving or not? Like, this is an absolute failure of communication and follow-up. Legally, I am not sure where everybody stands and where we can stand as a municipality, but I can tell you this building has taken the resources of the health department time and time again. We are happy to do our job, but the responsibility of the maintenance of the property is on the property manager. So I thank everybody for their participation. I don't know if there are any other comments from the board.
Elaine, why don't you unmute and go ahead?
Hi, my name's Elaine Silva. I've been on the board here since 2009. I have been in public health for over 20 years, and myself was the director and dealt with many housing inspections. This problem here at Colonial Point, as Laurel has pointed out, has always come down to communication. I don't know if it's because, is it an email? You know, you talk about sending emails. I mean, emails are recorded. People can prove that they have contacted you. You can prove that you've answered the email. The health department can prove whether or not they have received an email back from you in regards to questions and concerns. In regards to phones, is there a phone issue? You say that they think that the person didn't know how to use the phone, then that probably should have been addressed. But that what is constantly has been brought up here is the many concerns of these residents. We have gone, I think, above and beyond many, many times. I think Laura will agree, to help the residents and do what we can, but it's all communication. Even us contacting you has not been good. And it may last, I saw it once last for 30 days. And the following month, when it was brought back again, it was the same communication problem was brought forward. So I don't know. I don't know how you do it. I don't know if you have a big turnaround in your tenants every month, or is, do you have X amount move out, or do you have such a turnaround that the new tenants don't have their leases or they don't know? And maybe the resource would be to have a tenants association or a board, someone in there who maybe would want to take on the responsibility of at least knowing, and if there was a problem, that the proper person had received the email and had been recorded and the phone call had been recorded. And thank you everyone for coming on tonight and participating. Thank you, Candace.
Yeah, thank you, Elaine. I think I would echo Laurel and Elaine. I would defer to them on their experience. I have not been on the board as long as they have, but from what I'm hearing tonight, it seems like this boils down to accountability of the management group to the tenants. And I think accountability is not a one and done thing. I think accountability is something that you continue to work on every day, every month. So making sure that those numbers and that contact information is available and widely posted for the tenants, and that the people that are listed there are truly the people that are answering those communications, whether it's phone, text, email, whatever. I mean, I think email can be useful because, like Lane said, it's recorded. But I've been hearing how our Health and Human Services Department has put forth a lot of effort and time supporting this property and doing a lot of work that seems like the management company should be doing. So I'm hoping that you can take back what you heard today to the management company, and making sure that they realize that this is, on top of accountability, this is a dignity issue, treating the tenants with dignity, respecting their space, cleanliness, basic sanitation. These are things that can't be ignored. And so I appreciate everyone's participation, and I appreciate everyone coming to listen, because it sounds like this is something that a big change needs to happen. And so I look forward to hearing how things go moving forward.
So I have a question for both Anthony and Erin in regards to housing regulations and fines and penalties. I think we need to kind of figure out expectations on timing and turnaround. And take a look at this, and we may have to push this to another meeting just to really look at when this happens, this delay in responses here. Do we have on the books expectations, expected repair will be within, and then what the consequence is if it isn't, or the next step? Do we have to have DPW assist and then bill the company because they didn't respond quickly enough and it was an emergency? I think maybe we need to work with our housing authorities to kind of give us some guidance, because as a board of health, I think that we need to borrow some wisdom from other housing authorities to figure out how can we clarify expectations, and then have consequences when expectations are not met, have expectations agreed upon between the corporation and the tenants. This has happened. I expect a response in X amount of hours. If you do not get a response from this phone, start triaging it to another call. I just think, again, back to the communication, this has got to be tightened up. And, we will do what we can. We have limited powers per se. We can't dictate how someone is managed, but we can dictate the parameters and some consequences. And so I think we need to kind of look through that with our health inspectors to see where in the housing code we may be able to more appropriately, proactively tighten this up.
Sure,
So that's
yeah.
work for the future.
I think that's a good question. I think part of our process right now, pretty standard. We issue a letter, and there are timelines based on the severity of the issue, right? This is pretty uniform across the housing code. If we come across any housing code violation, depending on the the emergent condition, we will issue a time frame that we require a response. And like you said, sometimes these things cannot be corrected immediately. I would say that, I'll let Aaron go next, but I think, something like a sewage issue, I mean, sure, yeah, that can't be corrected immediately, right? But that can be immediately addressed, right? You can go and give us a plan of action. You can say, here's what we're gonna do, here's the mitigation in the meantime, here's what we expect. I mean, not until several communications has gone out have we been able to get that out of them, right? So that's just one example. But I think in general, there is a timeline. There very much is a timeline to fix. Some conditions are more emergency than others. But I think it's important for us to, have that constant communication, right? If we serve that letter, and that letter goes to Carabetta in Connecticut, that could take time, right? But I mean, if you have property management that is able to triage these in a timely fashion, then it wouldn't be an issue. We email, we call, we make sure that they have the information, and we can confirm how long it takes them to get to it.
Erin, why don't you go ahead?
Yeah, I was gonna say with the issue with the sewage and the sewer line break, they were given 24 hours to address it. And that's not 24 hours to fix the entire thing. It's 24 hours to make a good faith effort to start addressing the problem. I was told when it was a Wednesday, I was told, well, the line's gonna be repaired Monday. Like, well, what are you gonna do in the meantime about the sewage? Nothing. It's happening Monday. So then I have to write another order ordering them to clean up the sewage because, they should know what to do. They should know if there's a sewer line break and there's sewage on the road going into a secondary drinking water reservoir, they're supposed to self-report to DEP, get a pumping truck out there, and then clean up the other areas with lime. And we had to, be very clear about what they needed to do because they said, oh, it's going to be repaired Monday. We don't plan to do anything else. So it's things like that just, they take an abundance of resources on our part and constant monitoring because, in the meantime, there's sewage flowing into the wetlands and flowing down the road.
Thanks, Erin. Mr. Parnasso, I see you have your hand up. We did mostly close public participation. I'm willing to let you have a minute to share a comment, but please keep it to close to a minute, sir.
Okay, I'm actually part of the Carabetta management team.
Oh, very good. Apologies. Thank you for
Okay.
identifying yourself.
Yeah, I'm a director of operations for the Carabetta companies based out of Connecticut. I came up here to address many and all the issues that everybody brought up today. I took notes as far as everybody's comments and concerns, and I am here to repair the relationship, not just with the community of Colonial Point, but also with the city and all the officials in Wakefield. I'm in constant communication with the Wakefield Fire Department. We have a good working relationship because just like your department, they get called all the time for water leaks. And then I get a call from the captain at midnight and he knows my personal phone number and he calls me, hey, we just got a call for a water leak. I was like, why are they calling you? I was like, because they don't trust anybody to call anywhere else. So I'm addressing issues like this. One of the things that I already implemented at the site is I'm introducing a preventive maintenance plan. I'm not going to wait for the residents to call us. I'm going to go with a team in every unit and inspect the whole unit as far as what needs to be repaired, looked at, replaced, and et cetera. I don't want the Carabetta company name tarnished because of one property. And Attorney Russo mentioned some of the things that are caused by the residents. Everything has to be handled timely. I agree 100%. As of today, we have 0 work orders on our books. And I'm going to go around tomorrow and make sure that, and put out a notice to all our residents. If there is anything wrong currently in your apartment, please let us know. I'm going to provide my email address, not my cell phone number, but I'll provide my office number if they can't get a hold of the management team at Wakefield. As somebody stated, the person at Wakefield, property manager, should be accountable for the daily operations of the company. But if they don't, then they have to answer to me. So I refuse the property to fail I hear a lot of history going on between, I've heard from 2009 till now. We've been in business since 1948, 70 plus years. And I speak for the whole company that we pride ourselves on providing a good product to the whole company, to all our 30,000 residents. We have a 99%, 98% occupancy rate, and retention rate is incredible. I've never worked in a company that has this kind of retention rate. So my goal is to repair and upgrade any process that needs to be done, up until also including customer service if there isn't any at the property, because we need to be what's the word? We need to be concerned about our residents' needs. I've spoken to many of the residents. You hear only from the residents that have complaints. I've spoken to residents that have complaints. I've also spoken to residents that are very happy there. The trash chute was a big problem. If you don't check it periodically, it becomes a problem because some residents don't know that you can't throw cardboard down there and get stuck, and it just keeps bonding up. So yes, it is our responsibility to check it and make sure that it gets corrected ASAP. We have a trash service that we rely on now, that they're very good. They come out Mondays, Wednesdays, and Fridays, which has worked out very well. In bulk, a lot of times we have bulk items left over from past residents. They just leave everything behind and block all the electrical panels and fire panels. And I get a call from the fire marshal saying, hey, you need to correct this right away. And I do. I get a 30-yard dumpster out there and we get it corrected right away. The point I'm trying to make is I want to have an open communication with the city and with the staff and with the residents and correct all these issues. We're never going to make everybody happy, but I want to at least make 90% of the people happy. That's all I have to say.
Aldo, are you a new employee, or how long have you been with Carabetta?
I've been with the Carabetta companies for 10 years, based out of Connecticut corporate office. I'm responsible for the Carabetta portfolio. Colonial Point is not part of the Carabetta portfolio, but it is owned by the Carabetta companies.
Okay. Yeah, I just haven't seen your name before.
Yeah. So I'm up here to help
Okay.
from corporate.
Okay. Good. I'm hopeful.
Thank you.
Thank you.
And also, just one more thing I'd like to mention. When I found out, I received a call at 6:30 in the evening from Hector from DPW. And as soon as he informed me of the situation, I met with him the next morning. And not knowing suppliers up here, I asked Hector, who do you use? And he gave me 3 names, and I called them all, and they all came out, looked at the job, and they all gave me crazy amount of lead time because they're so busy. I had to get one of our contractors from Worcester to come up, the excavation company and the plumbing company, to come up and address the issue right away. And there was I made sure that the pump truck was there when needed. They were there in the beginning when you mentioned just sitting there, because it's not, the manhole didn't fill up right away. Every time there's a pump station somewhere down the road off our property. And when that pump station kicks in, that's when the manhole was getting flooded. So the driver called me and says, hey, I've been here for 6 hours and then there's no water coming in. I was like, okay, well, time it out, see how long it takes, So he did. It says it's probably about 6-7 hours that it needs to be pumped. I said, okay, make sure you go out there every 5 hours and check it out. And they did. They started doing that. And they were charging an extraordinary amount of money, $500 an hour, to stay there. The break was found and fixed as soon as we had the resources, and that was pretty much, as far as I'm concerned, like you said, right away we did it. And I would have never let that go any further. I would, even if we had to dig up ourselves, but with the help of Hector from DPW, we were able to address the issue and correct it ASAP.
In the spirit of preventative maintenance, I'm wondering, Aaron and Anthony, if we can have cross committee DPW and fire chief and health department actually book preemptive meetings every month to two, every month to go over, are there no work orders? Are we okay? I still think we should have a resident rep. And then spread that out. So, kind of using the medical model. You have a problem. I think I'm going to fix it. Let's talk about it in a month. In a month, it seems better. Okay, let's go out 2 to 3 months. Oh, this is absolutely stable. We can do this. We can do a check-in every 6 months. I think with the reputation, if, Aldo, you're serious about how you're looking at preventative work here, I think that this really could be a model for success. And it's very similar also to our food codes. So if you're a high-risk food code or you've had some issues, we're going to come back sooner. If you've proven that all of your employees get it, and sometimes we're getting better information from you, then we can back off a little bit, because the bottom line is our job is to keep the public safety. And I think that would go far in also giving the tenants a better quality of life, but also kind of resetting the expectation, because I think the expectations are dropped, and it just needs to be reset. So I'm very hopeful about how you're presenting this. And again, I think had we, I think we just have to make sure, even within our own town, that we have an Audubon property subcommittee that crosses at least 3, 4. I'm going to add conservation concerning partners, and probably we should also pull in our town council rep, who I believe is Ann Danahy, just because once it crosses, so this is a process amongst the municipality. So once it crosses to other departments, then we probably should pull in a board member from each of those entities.
Also, I'd like to just say one more thing. Attorney Russo mentioned that feel free to call him with any issues, but also I'm out there too for any daily issues. I don't think we want to call Attorney Russo for a clogged toilet, but if you hear of any complaints, feel free to call me directly, and I guarantee you they'll be fixed right away. And I will personally be responsive to the city and the residents. And if you want to give them my contact information, or if you know of any residents that have current issues that I don't have work orders for, I will meet with them directly and address all their issues.
Wonderful.
Thank you. Any other further comments? Laura, Lelaine, Anthony, Aaron? Attorney Russo or
No, I think we've said it all.
Mr. Parnasso? Anything
I'm
further?
good. No, I'm done. Thank you.
Okay.
So I don't believe that we have, and we're not going to finish up with any more public comment. That part is closed, but I don't think we have a motion to be made. I think that we did a lot of problem solving tonight. So I am happy to table a conversation with follow-up between our health agent and health director, DPW, and the entities within town.
Agreed. Maybe we could put this on the agenda for next month, or 2 months, and sort of check in, see how things have been. Okay. Thank you, everybody who participated and listened. Anthony, I guess that leaves us with your health director's report.
Thank you very much for having us.
Yeah,
Good
thank
night.
you, sir.
Thank you.
Thank you, Mr. Russo.
Thank you.
All right, so we're on to the health director's report. 1 second. Okay, so I wanted to start off by saying thank you again, everybody, for all your support. We had a very successful Farmers Market Town Day clinic. So we were able to provide, and Cindy, correct me if I'm wrong, I think just under 200 doses of flu shot. Is that right? Yep. Okay. So we will provide just under 200 shots. Our very own Candace Linehan was there providing shots along with Melissa. So you guys were great. Lots of residents got their shots. I think we gave out roughly 40 around Farmers Market and the rest of Town Day. It was just a great event. I think it was nice to see everybody back out again. I think the festivities and all the resources we had Jason Stone out there, our social service coordinator. He was able to kind of connect with residents, kind of show his face, get everybody kind of familiar with what he does and what he's able to provide. So I think that was a great opportunity. We also had a representation from Youth Action Team, as well as Amy Girovalati. She's our new prevention wellness coordinator, working with Catherine on the DFC grant. So a lot of their activities revolving around the schools were able to be showcased as well that day. So all around a great effort. Cindy, you had a couple of family members jump in to help us as well. So it was a great team effort. So thank you again. And then going back a little bit further, Laurel and Elaine came to help us at our very successful COVID clinic at Memorial Hall in Melrose. We did a joint Melrose Wakefield clinic. We gave, I believe, just under 200. I think we gave just under 200 doses, 198. Melissa, is that correct? We gave out 198. We only wasted one dose, and Melissa and Sandra Brown went one step above and actually went to a homebound visit right after our clinic around 9 o'clock. So I want to give a big shout out to you guys. You guys are really embody customer service. I was kind of worried. I was like, this is kind of late. You guys still want to go, but you guys went.
We
so,
did it.
Yeah, you guys are great. So thank you again. We also had Maureen, Steve Mayo stopped by. We had a lot of help. So thank you again to all the volunteers, Melrose, Wakefield, and outside for coming to help us with that. So yeah, it was a great effort. Let's see. So Cindy, I think for some reason I've misplaced the health director's report, but I did have it written down this time. So so let me see if I can find it. So
Melissa, can you just clarify, because you've got future clinics and it's not the day I said I would work. So is there a clinic on the 25th or not? Because I made arrangements to be somewhere that day. Did we not have that clinic Tuesday?
Oh,
There is a clinic, but I don't think you're scheduled to work it.
Am I scheduled for the 26th? Because that would be an error because I have to work on the 26th.
I don't have
That's fine.
a clinic in front of me. I'll email you later and let you know.
Not appropriate for a public meeting, but yes, I'll double check with you.
Okay, that sounds good. Cindy, while I go over the next item, if you still have that report, if you don't mind forwarding it to me, I will go off that so I don't miss anything. But just going off the top of my head, we have flu clinics coming up as well. So we still have flu clinics lined up, but we also have drop-in hours as well. So every Wednesday from 9 a.m. to 11 a.m., anybody is free to come and get their flu shot. I believe we have a link out there as well, but if not, you can register on site, and Melissa and Sandra will work together to provide flu shots throughout the season. So we have that great resource as well. In terms of grant announcements, we also have exciting news to announce. We received recently, in a partnership with City of Melrose and Town of Stoneham school districts, we actually wrote for a Department of Justice grant around school violence prevention. And we received that grant 2 weeks ago. We were awarded $1 million over the next 3 years. So we can benefit each of the 3 school districts by hiring a full-time adjustment counselor for each of the districts, funded for 3 years. And then we're going to be using some of that money as well to provide training around de-escalation, around violence prevention, dating violence prevention, just any kind of wraparound services we can provide. This will be all done in partnership with our Wake Up Coalition, our great school system in Wakefield. We also have MAVE and WAVE from each town participating. So we're going to have a lot of stakeholders in this, but I think everybody stands to benefit from working together on this project. And I think there's great. This highlights a great need we have in our school system in terms of post-COVID environment for students and families as well. I think being able to provide that resource is going to be really important. So more to come down the line, but we kind of have an outline already ready to go for this grant. So we'll be we'll be doing some regular reporting out for this grant as well. So were there any questions about this grant or anything so far?
Well, I just want to make the comment and that, so we often wake up, often convenes the Tuesday before our Board of Health meetings. Once again, I just cannot believe the talent in the room. I mean, the talent and the cooperation between school and police and other stakeholders, and we have someone from Wave there. We send our person to the Wave meetings because it's all certainly interconnected.
And Board of Health, Laurel,
and
don't forget, you're there too.
Well, yeah, well, that's what I'm saying. So, Grant is part of us, so it goes without saying. But that is not the case in other towns. Sometimes school department, and I think because the fiduciary in the Wake Up grant, the drug-free community grant is with the health department after talking to people who have managed it where they're it may be with the police department or maybe with the school department. I'm really convinced that our model works. I don't know, there's something about, first of all, Catherine's talent for crossing across many stakeholders that is unmatched, but also we're just lucky. I mean, I get cranky about potholes, but when I get into these meetings, I cannot say enough about the compassion and the talent. Library is a stakeholder, people cooperating, everyone wants to do better. I don't think anytime people get exposed to the work that we've done, they want to do more, which is looking good in our town budget to kind of support that. So I will never stop bragging about how proud I am of that coalition. That being said,
Yeah.
are you board members? You should be on the distribution list now, so you're getting the monthly minutes and agenda. Okay, that wasn't happening, so good job.
Thank you, Laurel. I think you're right. It's very important to kind of highlight the great work that's being done, because a lot of this work that we're doing right now is prevention. Prevention is the name of the game, right? So one of the things we wanted to push was that for the town to understand all these great prevention services are helping us move forward, so we're not responding to these crises as much. So I think that was good to go over. We're also excited to announce that we are sort of in the process right now of putting together a Health and Human Services regionalization project. So we're working closely with the City of Melrose, obviously, in this regional project. We're looking to add the Town of Stoneham Health Department to this group. I think it's important. I mean, just recently in the news, we saw that overdoses we've seen an uptick in overdoses. Town of Stoneham, Wakefield, and City of Melrose, we don't have the same population, but we share some of the, some similar issues, right? And so I think the collaboration opportunity between these three towns is a great opportunity. An example of that is the grant that we just wrote for. Having that extra population boost puts us in line with some of these larger communities that can apply for state and federal grants that we otherwise wouldn't be eligible for. So I think it's important for us to consider, our next door neighbors, may have similar concerns. And so if we're able to partner with them, then we can kind of create some standardization across the board on kind of how we do things. So this will only stand to benefit from that. We're definitely looking at, potential concerns about diluting current workforce amongst the three communities. So we're working very closely with the Town of Stoneham to ensure that we're going to have, the resources we need to continue the level of service, if not improve on the current level of service, and be able to kind of do that. So, another example of cross-community collaboration, we work very closely with the Stoneham Boys and Girls Club. They run great programs. They have a teen center model that is a pillar in the state. I think it's something that we would love to see expanded, if not replicated, in our other communities as well. So I think, with that great partnership and their willingness to help with community contributions, I think it's going to be important for us to keep that relationship and expand it if possible. So this process will be ongoing. We'll have more updates for the board as they come. But, stay tuned. And if there's any concerns, obviously reach out in the interim, or if there's any questions now, I'm happy to answer them too. But yeah, this is an exciting opportunity to, bring in the region.
I would just like to, I'm so talkative tonight. I would like to just kind of learn from history, because we have expanded to, and we have stretched our health director over 3 municipalities in the past. And it's a hard ask. What I think is different this time is we have a designated assistant. What is Catherine's role?
Assistant Director of Human Services.
Yeah, so I think that we need to be really mindful that that model is consistent across the communities, like who's next, because, when we, again, Lane and I are dating ourselves, but we were there to watch the transition from Wakefield being by itself to joining with Melrose. And then we tried to expand that a little bit more, and it was just a little bit different. It was challenging. And I always kind of say to myself, when do we step in as a board? What's our role aside from just sitting there and saying, okay, what's a rule and reg and what's a policy? And we don't do the hiring and firing in the department. Our job is to be sure that Wakefield is always served. And it's our job as a board to always say, okay, where are the blind spots? What aren't we seeing? If something worked in Melrose and Stoneham, what do we have to tweak to make it work in Wakefield in our community? So I just, I'm going to be a bit of a badger about it, because I just don't want us to lose anything. I love the way you describe the advantage to regionalization, but we need to use our talent. And I would say that if we had a theme of tonight's meeting, it was lack of communication. So with, and that, we learned something, right? It's like, hey, we need more, we need a coalition here. So.
Well, the good thing is, I have a great willingness to pick up the phone. The three of you get endless calls. Elaine's laughing because you just get a call from me earlier. But yeah, I totally get where you're coming from, and I think the good thing about this regionalization project is that the idea is that the 3 towns would maintain autonomy when it comes to the Board of Health, and that is really important, because you guys are the ones that are basically keeping us in check to make sure that everything is being served for the town of Wakefield as well. Because you're right, I think when we expand out to this larger service area, there are going to be potential opportunities for things to fall through the cracks. So I think it's important. You guys are obviously more than capable. So it's great to have you guys on there and keeping us able to continue the service that we were providing before. So.
The other opportunity is that, and we have done this in the past, so always, happy anniversary to you, Anthony. Been here a year, right? Almost, yes?
Yes, it has.
Yeah.
You guys aren't tired of me yet?
Yeah, so honeymoon's over. So that when it's appropriate, that we don't make you repeat yourself to 3 separate boards. So so at least once or twice a year, we try to have all the boards convene in the same room. I'd love to get back in a room
in person
to hear, presentations that had to do with us all. So, particular grants that covered all 3 of us, particular presentations that covered everybody from Middlesex mosquito control, for instance, that we would kind of consolidate those presentations so that everybody was hearing it at the same time, and then come back to our own boards to either do voting or policy or something. So it's just, there's some just logistics to consider.
I think that, with adding another community on, we've seen what it can do to a director, or, put you in 5 different spaces and trying to coordinate meetings and everything else. But I have faith in it. I really do, because regionalization is going to be the thing, how it hasn't happened in the last 5 years. But I think now you're going to see it even more. We have it, amongst our public health nurses. It's the biggest thing going. And it will be at APHA when Anthony is there. I know he will be there, but I'm confident. Huh? November 4th. I know I have to be in there on Saturday. That's all I can remember. Hopefully I'm going to get there with, if everything goes well, I will be able to get in there actually physically, I'm hoping. But I'm confident only, Anthony, because of the direction you have made Melrose and Wakefield. I think that you've done a little bit of reorganization, brought on a lot, good inspectors, challenging with that our grant, our comprehensive grant, that was a big undertaking to begin with us, and to really push it forward after we had done the groundwork. And I think by going after these grants and these other positions, I think it's going to assist us in being a bigger region. I just don't want everyone to think that they can join our region. That's all. I just, I'm gonna have to think about that, who it is. There are other health departments, I've heard through the grapevine, that they are in the process of doing regionalization, and they've inquired about ours. And with my students, I'm pushing for them to come here. I don't know yet if they are. I'm hoping in the spring semester. And that was one of my big things, was because we had a great program here in Melrose and Wakefield, and to see the regionalization and to see public health. It is real view, and to see the boards, and always remember your boards of health have got to be separate, because we each have to bring forth what our community needs the most. And I think we're going to know it. But I'm excited. I hope everything goes well. I really do. I'm very excited about it.
Thank you, Elaine.
I'm excited too.
I was just waiting for you to say it, Candace.
Yep.
Okay.
You got my goal. Yeah, I'm excited too. Yeah, I do think that joining with Stoneham, I think we can probably all learn a lot from each other, the three towns. I know we're already pretty tied in with Melrose, but I think Laurel and Elaine voiced some very reasonable concerns about stretching our resources then. So I think we'll be mindful of that, and making sure that we continue to represent Wakefield like we already are. So.
Yeah, I think we have the supports in place. Erin is an amazing inspector. Just the experience she brings. This wouldn't be possible if we didn't have someone as competent in that area as she is. And then we also have Melissa, who will be the shared public health nurse. Just her years of expertise and ability to work with people. She gets things done. I also lean very heavily on Cindy, our admin as well. And Denise as well in Melrose. We have a great team, and we absolutely need all these supports in place to make that work. So there's areas that we can still improve in, and I think we're getting there slowly but surely. I think that's all I have. Cindy, Melissa, have I missed anything?
I have a question. If you haven't missed anything.
Yep.
The statement about reproductive access.
Oh yes, that can be done very soon.
Let's do that.
Yes, absolutely.
Thank
Yep,
you.
that's a good idea. That will be to you guys very soon, hopefully tomorrow. One last thing actually reminded me. Melissa, our very own Melissa Lowry, was on TV today. Please go and look at her. Watch our video on WCAT. We were on the town administrator's report as guests today. We have people getting flu shots live on television. Melissa dropped everything when I forgot about the program and asked her to come over from a different clinic. So thank you again, Melissa. And Cindy, you ran over to that other clinic to help us cover that. So I appreciate the flexibility. Steve Mayo and our host actually both got their shots. David Watts was fair game for that as well. So we were able to give out a couple flu shots. Want to make sure the public is comfortable with the idea, and it's a great program.
Well done. How's your arm, Anthony?
My arm's good. I already got my shots.
Yeah, I know.
I didn't want to cry on TV, so no, No, but it was a great time, and Melissa, thank you for doing that again. So.
Sure, Anthony.
And then the walk-in clinic was the first clinic ever. We started a new walk-in every Wednesday, 9 to 11.
Yes.
And Candace was very busy today. We gave 13. So we did put that on the website, and
Great.
it was out on, Jen put it in the newspaper, social media. And we have people signed up every Wednesday through December. Yep, so that's cool.
That's a great idea. I'd be interested to hear like what kind of numbers you guys get for walk-ins.
Yep.
Yeah. We also have a Cindy, can you give me the date again? Regional Family Flu Clinic coming to the AmeriCal Civic Center. It's going to be 9 a.m. to 1 p.m.
November.
Some of the date.
November 5th, yeah.
November 5th, perfect. Okay, so November 5th, family clinic at the
Yes.
AmeriCal, very successful last year. Hopefully we'll get a good turnout this year as well.
I've heard, especially on Town Day, that some of our residents were talking about how challenging it is to schedule flu vaccine appointments at some of the local pharmacies. So I think being able to offer this service is really big. And it's, I think it's a little cumbersome to register for it on Color, but it's manageable. And I think, I know at least at Town Day that some of the registration folks were walking residents through it, which was really helpful. So I think this is a big service, especially being able to do it for a whole family. I'm excited we're doing it.
I think
And
online oh, sorry, go ahead, Cindy. Go ahead.
That's right. The last I checked, the school nurses are busy doing their own clinics at each school. And they had 99 done, I believe, and about 70 more to go.
And they're doing staff. They don't do the kids. They do staff.
Nope,
They
just
do
staff.
Just staff.
So,
Good to hear.
I was going
Yeah.
to say, Candace, I think there's always limitations to online registration. I think we have to consider our senior folks, and folks that may not be as computer literate. But I think, color may be the registration compared to other places, maybe the lesser of two evils.
Oh, great. I've
Yeah.
registered at a pharmacy and Color was
Yeah.
simpler. Yeah.
So,
Yeah, and I think too, if we just tell people, walk-ins,
yes.
may be available, not guaranteed, but available, and then we just do it. Because it's true. It's, we really have, kind of have the haves and the have-nots with all of this technology to access, and people are like, I'm not doing it. Either they don't want one more thing on their phone. I'm in that camp, or, where's this information going? So it's, or they just don't like, they don't like the tech. So that's great. It's National Pharmacist Appreciation Week. I keep being told as I've been on hold calling in orders, and I it is interesting because we gave from when the H1N1 happened again to Elaine and I in 2009. That was how we bonded with Melrose over regionalization, and we deputized pharmacies at that time to start doing vaccination. And I feel like, especially these days, that they are getting kind of tapped out. Like I sort of felt like they had taken taken the business away. And I like the history of kind of, it was like doing a quick health assessment of the town. Who's coming back for their flu and pneumovax? And, it was kind of a nice, quick town assessment. I feel like, we're kind of coming back, and that we're all in, because the poor I feel badly for the pharmacists. I think adding vaccines to their load is a good business plan, but it looks rough.
It's very rough. I've had worked with a couple of pharmacists, and implementing that in the middle of the day, if they're in the middle of doing something. A lot of pharmacies did reach out and hire temp nurses, especially during COVID, but that's gone back down because all those nurses are now doing traveling nurses.
Or back to work.
And, you don't see them. But it also was back in H1N1 was your EMTs and your paramedics. I did many a clinic with them, also administering, flu. And I think we've just tapped out to the point. I think we just don't have that many. A lot of health departments are not very fond of color. And I think that their main problem, I talked to two of them yesterday about that, because I tell them how we love it. Right, Cindy? We love the classes. We love to be on the same class on color. They got a bug. They got a new bug tonight. And I told them, I think it's half of the thing is whether or not your community has got the volunteers. And I think that between Melrose and Wakefield, the amount of volunteers we have, not only the nurses that we've retained since the COVID. I've heard my friend, one of my friends was there again. Somebody saw her up at the lake or something doing them. And I think the fact that we have the people that will step forward and help us with the computers and the laptops, they were amazed. They had people that wouldn't even bother to help them. And who else can you go in and get your flu shot and the nurse does all your registration, and then we go over the other side of the table and we give you a flu shot. I mean, that's something that a lot of cities and towns don't have. And I commend us. And Cindy worked very, very hard on that for a long time to get us on to color. Let me tell you, that is not, and it's not easy remaining on it. Those classes are, I just pray that she's on them. I look down the list and I go, thank God she's on it too. She'll understand more than me.
Yeah, I'm just
But,
showing you a shot. Well, that
but
being
being the-
said, I think we need to do a photo op at the family clinic with permission, because I don't think that we're pushing out the good news quite enough. And I think, you know, I was reflecting on this year in times where I was quite frustrated with some editorializing and realized that we didn't really get proper coverage for the colossal job that we did in the beginning of the COVID-19. We didn't have, I mean, I think we got some Boston Globe press, but we didn't get anything local. So I think we need to command our own message. And, you know, I'll think more on it, maybe write it myself, but maybe work with Jen and say, and here we are, and we're doing it, and we're continuing to do it. And you're
Laurel, that's a good segue, because we have a newsletter coming out, the quarterly newsletter, very soon. I think it's coming out this month,
Right.
or probably this month or beginning of next month. So
I saw
Catherine,
Melrose's and I was like, what's up with that?
yeah, Catherine worked very closely with Kara. We were able to develop. We're doing two separate ones, but I think the achievements of both departments,
Yep.
you know, have been great, and it deserves its own space. We're working very closely with town and city councilors to make sure that we get this information out to them and they can get it to their constituents.
Good.
And Jen McDonald is great. She also helps push us out as well. So I think it's important to get the word out of what we're doing, of how the town is benefiting, and we want to make sure that we continue providing that service. So, yep, that's all I had for the report. Just want to thank the board again for helping us with 95 Audubon Colonial Point. It's not a one-shot solution, and you know, those of you that have been here for all these years, you know it's not going to be solved immediately. Tonight was just step one to holding them accountable, and hopefully we see things improve, because we really do care about the residents that live there.
Well, it seemed like a breakthrough that the last gentleman, I mean, I'm hoping that was a breakthrough where Aldo spoke. I'm like, really? What's your name?
It's okay, Laurel. We're tireless. We won't let
I
him get out.
No, I know. So I would propose that you start doing it, like put his, you know, put him to his
Gotta
word.
be
and say,
accountable.
"Okay, we're gonna
We
make him
did that
accountable and
before.
come to the meeting."
Yeah. We did that before with the pool, remember? We
Yeah.
brought them 2 or 3 times. They goofed the second time I caught them, but on that. But after that, they were pretty good about it. They really were, because they knew they were going to be called for it. And, you know, maybe that's the way, unfortunately. Maybe that's the only way to get them on track. Let's hope. I think it was great to see so many residents come and listen tonight about it. It really was great. Very, very nice for them to come
And
on.
Lorraine, you're still there on the call, so I
Yeah,
guess we're
God
gonna-
bless
we're
you.
gonna have to elect you representative.
Yeah.
Oh,
Yeah.
okay.
You
It
tell
was
us
it's
now.
nice.
It's interesting listening to all of you. I love listening about Wakefield.
Oh, good.
Nice.
We'll be here every month, Lorraine.
Yeah.
Feel free to join
We're
us.
better than TV. We're lucky.
Yeah.
You are better than TV. I commend all of you.
Thank you.
Thank
Yep.
you.
So, you know,
Yes.
just great. Just glad that we got across the message. You know, we want to protect the residents, and you know, at the end of the day, the buck stops with, you know, whoever owns the building. They are taking full responsibility. So we'll make sure they do.
It seems like Erin's really involved too. She was wonderful tonight.
Yes, Erin has been boots on the ground. I mean, you know, nose on the street, especially with the sewage. I mean, you know, not to be crass, but it did smell really bad. But just in general, I mean, it's just great to have Erin, doing some of that legwork too, because she's able to, advise us on all the conditions that go with it. So
Yeah, I've enjoyed working with her.
Cool.
It's fun. I love to read her reports, I told her.
okay, that's all I had.
November 16th?
Not going anywhere. 6 o'clock.
Is the 16th, is that what you said?
I believe
Yeah.
that's the third, right?
The third
Yeah.
one, okay. I'm sorry, I'm very confused. I'm on 4
The week
committees
before
that all have fundraisers this month, and I'm
Elaine,
so confused.
stop it.
I'm not kidding. Tonight I'm so confused. I don't even know today. I was on my third Zoom meeting in the middle of physical therapy and visiting nurses, and I'm like, oh my God, I didn't write you a check. How much do you want?
Did you guys notice that Elaine slid it in there that she's raising a lot of money just subtly there? So thank you, Elaine. I know you're good at it.
Somebody proposed something today, and I'm looking at them, and she's going, well, I'll make the donation. The bill. I said, do they know how much this bill is? But I don't know.
If you
It's
ever
all
need
for the
any
good.
help, I'll help you guys.
Oh,
Oh,
all
thank
right.
you. I like
Let me
that.
get her information.
We
Yeah,
know where
so-
you live.
Oh, yes, you do. It has to be
16th.
morning, so I'm a bus monitor.
Oh, honest.
All right.
That's
The
awesome.
16th's okay. I was just confused on the date with the conference, the national conference coming up, but I'll be back by then.
Okay, great. Awesome. Good meeting, team. Any last words?
Yep.
Make a motion to adjourn.
Great.
Can I ask one question though?
Oh,
Okay.
The attorney's information.
Oh,
you ha-
Erin.
it was Robert Russo, is that right,
And-
Cindy?
Yeah, that's the name, but he said he gave one of you his phone number.
Does Erin have it?
Erin has the phone number. Yep, we have.
Otherwise, I can get it from Aldo.
Yeah, I
Oh,
would get
yeah,
it.
you get it
After
from
my
Aldo
first
too.
bus run.
And I believe he mentioned that it was going to be posted in the area in the building.
Yes.
He mentioned that, so.
Oh, it's
Yeah,
on
well-
public meeting. It's on public meeting, Candace.
Yep.
We all saw it.
Yep.
Yeah, so we will go down there and make sure it's all posted.
Great.
All right, thank you very much.
Thank you, Lorraine.
Thanks for
Thank you,
joining us.
Lorraine.
All right.
Okay, bye.
That was fun. All right.
Good night, everybody.
Good night.
Halloween,
Oh, wait a
everybody.
minute, you made a motion.
I
Laura
made
made a
to-
motion.
to close. Oh,
And I'll
yeah, wanna
second the
vote?
motion to adjourn.
All
And
right.
hope I see your faces all at APHA in Boston. This is very
Hey, speaking
important.
of faces, can we meet in person again?
I asked that.
Let us know.
There's
Not
higher,
yet.
there are higher powers at work.
It's
Town
being
council is
asked.
Meeting in person, school committee is meeting in person. I don't know why we don't rank. There's only a few of us, for God's sakes. We have N95s if we have to. All right. Well, nice seeing everybody. So
Nice to see
we're
you.
adjourned. Did we
Thank
say
you,
aye?
everyone.
Aye, aye.
We had a second. We are
Thank you.
adjourned. Yeah.
Nighty night.
Good night, everybody. Thank you.
Right.